I'm Dr. Devendra Kundra, working as a pulmonologist at Manipal Hospital, Dwarka. In today's era, as the people are too much busy in their work and they don't get time to hit the gym or do proper exercises to maintain their weight, which causes increase in their weight, and some people become obese and some go to the overweight side. As the weight increases with poor lifestyle, it causes so many problems, and among them one of the most common is breathing disorder associated with sleep, which is known as obstructive sleep apnea. Actually, these patients have symptoms like snoring while they are sleeping and choking when they are asleep. They wake up with a choking sensation. And whenever they get up in the morning, they have headache, heaviness in the head. Some patients remain irritable throughout the day. Some patient complains that they have started forgetting things. And actually, what happens with them? It is a obstructive sleep apnea which is causing those symptoms to them. And what happens in that disease? I tell you that whenever the patient who are obese, they sleep, it causes the relaxation, too much relaxation of their throat muscles, which causes the compression of the upper airway. So that when the patient sleeps, so the amount of the air goes inside the lung is reduced. Because of this reduced volume of the air in the lungs, the amount of the oxygen received to the organs of the body is already reduced. So overnight, when the oxygen is reduced and the brain is not getting a proper amount of oxygen, it causes the repeated stimulation of the brain cells. And patient though sleeping, but the brain activity remains activated rather than going into the resting phase. So when the patient wake up in the morning, patient complains of headache. Patient feels that it was not a refreshing sleep, and patient feels excessive daytime sleepiness throughout the day. They have a problem with the concentration while at the work or even at the home. Some patient feels sleepy even while driving. I must say that whenever somebody feels sleepy while driving, it is a very alarming situation because the patient can meet an accident. So whosoever come to my OPD with all these symptoms, whether the person is obese or not, as I said, though the disease mostly is seen in obese, but in fact the patient who are having lean body mass, they can also have OSA, obstructive sleep apnea, because of the anatomical defect in their upper airways or some other reason. So I always ask my patient to undergo evaluation for the obstructive sleep apnea, which requires a sleep study. It's an overnight sleep study which is conducted at hospital, which is called a complete polysomnography. Or if the patients are not able to come to the hospital for the sleep study, this study can be done at their home also. Once the diagnosis is made that the patient is having obstructive sleep apnea, I advise them to take the treatment accordingly, in which the positive pressure airway, which is a continuous CPAP therapy, is advised to them to take at home. It's actually a machine which they apply to their nose, which gives positive pressure to the upper airways, keep the upper airway open and patent while patient asleep, so that the patient when sleep with the CPAP applied to the nose, the patient has a sound sleep, and the amount of the oxygen received to the body of the patient remains adequate throughout the night. And once the patient gets adapted to the CPAP therapy, patient himself or herself feel that the symptoms are improving, patient live a better life, and the quality of life improve, even the quality of sleep improves. There is no fragmentation of sleep, and patient perform better at the workplace as well as at home, and patient lives a healthy and better life with that therapy. So I must say that whosoever have all these symptoms like snoring, though in our Indian population it has been seen patients who complain of snoring, they think that snoring is just nothing, it is something which everyone has. But I must say that all the snoring are though not OSA, but most of the snorings have been turned out into obstructive sleep apnea. So whosoever is having snoring with a poor lifestyle and the symptoms, as I said, must get themselves evaluated for the obstructive sleep apnea.